Succes i veterinær praksis, podcast nummer 178. Hej og velkommen til. Dyrlæge Søren Pejstrup her. Fokus på dagens emne har, tro det eller lad være, været noget af det, der har hjulpet min kommunikation allermest over for de klienter, som ellers går for måske at være lidt svære at have med at gøre, hvor kommunikationen måske skrider lidt, og man bagefter står tilbage med et skuldertræk og tænker, hvad skete der lige der? Og derfor er jeg utrolig glad for at have mødt Kirstie, som vi skal snakke med i dag, som har noget insiderviden i, hvordan en sådan lidt anderledes skruet sammen, måske lidt kringlet hjerne ellers fungerer. Hvis du lige skal have en reminder om det her med succes veterinær praksis, så husk lige at kigge over på hjemmesiden. Der er selvfølgelig noter og links til det, vi snakker om i dag, og der er også 2 videoer, som kan give sådan lidt et indblik af, hvordan det måske føles at være inde i hovedet på nogle af de mennesker, som vi skal snakke om i dag. Så tag et kig på de videoer. De ligger på SIVP.dk/178. Og når du nu er derovre, så tag også lige et kig på de online kurser, der ligger. Du kan få adgang direkte i menuen oppe i toppen, og hvis du vil have 4 ugers gratis adgang, så kan du også få det på SIVP.dk/4 uger. Udover det, så ligger der jo alle de andre podcast hele vejen op til dagens episode, som er nummer 178. Sådan for at gøre det lidt let for dig, så har jeg lavet sådan nogle samleartikler, som du også kan få adgang til op i menuen. Der står enten brush up eller start her, lidt efter hvornår du kigger på det her. Og der er altså nogle artikler, som samler de vigtigste podcast til nogle enkelte emner. Der er lidt om ortopædi, og lidt om stress, og lidt om at drive klinik, og lidt om endokrine sygdomme og sådan noget. Du kan tage et kig på det næste gang, du er forbi en skærm. Tilfældet ville, at dagen efter jeg havde optaget det her interview, så møder jeg en klient, en ejer i klinikken, som bliver overleveret af en af mine kollegaer med ordene om, at jeg måske skal være lidt omhyggelig, lidt forsigtig i min kommunikation, fordi hun kunne være lidt svær at kommunikere med, mente min kollega. Og jeg tror, han ligesom lægger et hint ind til, at jeg godt kan bruge lidt mange ord, og det kan gå lidt stærkt nogle gange, om jeg lige skulle sådan prøve at tage det forsigtigt oppefra. Og ganske rigtigt, da jeg spørger ind til det, og vi ligesom får snakket med den her ejer, så viser det sig, at hun ligesom kan få meddelt, at hun har nogle udfordringer uden selv at komme videre ind på det. Og jeg, fordi at jeg så ved det, og så lige netop har lavet det her interview, faktisk er i stand til at prøve at skifte min kommunikation og hjælpe hende opfra og spørge ind til, har jeg gjort det rigtigt? Kan vi hjælpe dig på nogen måde? Er det bedre, at du henter medicin her på klinikken, frem for at skal ned på et apotek, hvor det kan være svært at komme, og hvor der er mange mennesker. Og alt det her, uden at vi har snakket om hendes diagnose eller noget som helst andet, det formår faktisk at ramme hende på en måde, så hun bagefter siger dybfølt tak for at være blevet hørt og mødt. Og det er bare en enkelt case, ikke også, hvor jeg ligesom pusher min egen glorie, men uden sådan at kende noget til hendes baggrund eller noget som helst om, hvad hun ellers døjer med, så lykkes det at få en positiv oplevelse ud af det, ud fra det, som vi faktisk skal snakke om i dag. Så jeg håber, at du får noget ud af det og vil lytte med, for nu skal vi over til interviewet med Kirstie. Hi Kirstie, and welcome to the podcast.
Hello, thank you.
So before we dive in, I'd like to have a short introduction of you. Of course, I saw you speak on the BSAVA Congress, and that was pretty enlightening to me. And you broadened my horizon quite a bit in a short matter of time on that in that talk. So I was hoping that we could maybe bring this to the audience and broaden the horizon of the listeners here as well. But before we dive in, please give a short introduction to what's important to know about you.
Okay, so I graduated from Glasgow Vet School many years ago now in 1996. And I became an equine medicine specialist, and so I'm a European diplomat of the European College of Equine internal medicine, and I've worked in both private practice and in academia. And I'm also a mum. I have 2 kids, and my life has been shaped quite a bit, although largely unbeknown to me, by being neurodivergent. So I'm autistic, but I only found this out 3 years ago when I was 47, after my daughter was diagnosed at, I guess she was 8 when she was diagnosed. So my diagnosis followed on from her diagnosis after I read lots about women and autism, because women can present very differently, and so have been missed over the years by the diagnostic system. And particularly if you're what can be called high functioning, but basically if you can get by in the system, then you fly under the radar and are missed. So that the last 3 years has been quite a learning curve for me, as I've understood what that's meant, how it has affected my life. And so now I'm very passionate about sort of sharing what I've learned and trying to enlighten other people about the topic of neurodiversity, particularly within the veterinary profession.
Yeah. So we will circle back to what neurodiversity actually means. But I was coming to this conversation with the thought that we should talk about only clients, because that's the neurodivergent people I think I meet. But you said that that I could actually have colleagues, veterinarians and nurses, that are underdiagnosed, and that would be true in your case as well.
For sure. And since I've started talking about this, I've had lots of people come to me and say, I identify with everything you say, or, lots of what you say. Could I be neurodivergent? And the answer is yes, quite possibly, because actually the diagnostic criteria are out of date. That the diagnostic criteria were formed around the male presentation of autism. So particularly women have been missed by that. And certainly I had been seen by, several mental health professionals for anxiety and depression, and it had never once been flagged that maybe these were related to being neurodivergent. So yes, I think there definitely are people who haven't been diagnosed. I think there's also people living quite successfully being neurodivergent and don't necessarily need a diagnosis. But I think there will be some people who are neurodivergent, don't know, and actually would find diagnosis helpful, because it would put their difficulties or their challenges into context, and then they know how to avoid triggers and can have adjustments so that that they can manage their workload or their lifestyle better.
So we should talk about actually what being neurodivergent means, but it also presents a gray zone there, because if you say that there's someone is living a happy life without knowing they actually have some kind of divergence, and on the other spectrum you have maybe a client that is acting very unregular in the waiting room, and that's a spectrum, right? And there must be some kind of gray zone in there where's the line of I hesitate to say normal and out of on the spectrum.
So if we think about neurodiversity is a spectrum. So that term was coined by a lady called Judy Singer, who's an Australian, back in the 80s and late 80s, early 90s, and it basically is like there's an infinite possibilities of ways that the brain can work. So just like biodiversity, neurodiversity is a positive thing, and it just means that no two brains think alike. Now you have a majority of people who think enough alike that they are considered the normal because they're the majority. So if you're the majority, you are perceived as normal, or neurotypical is another term. If you fall out with that majority, then you are divergent because you're different from the majority. So within that neurodivergent population, there'll be lots of different neurodivergent conditions. But if you take autism as an example, the autistic traits themselves, so attention to detail, rumination, things like that, they will be, and sensory sensitivity, sensory processing challenges, differences. So they will be on a scale of 0 to 100, say, and you can score anywhere along that on all these different traits. And those traits are expressed across the human population. So it's not that they are only seen in autistic people, they're seen across everybody. It's just that to get a diagnosis of, for example, autism, you have to score high enough across enough of those traits so that you are, seen as different. So the traits themselves aren't abnormal, if that's what you want to call it, but you express those in a high enough way, or you have enough of them that they make you different from the majority. Does that make sense?
But yeah, it does. But maybe you can give some examples, because we are not talking about intelligence here, because obviously you are very highly intelligent and very educated, and so that's, it's not that. But what is it then?
So
just examples, I mean.
Yeah. So if I talk about me and my daughter, because we're two autistic people, but yet we actually present very differently. So she has lots of sensory processing differences. So she is very, very tactile to different sensory sensations. So certain clothes are very difficult for her to wear. She gets very irritated by certain fabrics. She has great olfactory sensitivity, so certain smells will make her feel really ill. Like new paint is really an awful smell for her, and she can't be in a room that's newly painted. I don't have any of those, so I would score very low on those, but I might score very high on other traits like hyperfocus and social anxiety. So, everybody is different, even within a neurodivergent population of autistic people. So it's all about the particular presentation, but also you can score differently on that chart in a different environment. So, for example, my daughter has great sensory sensitivity in certain environments, for example, like in a newly painted room, but not in a regular room, so it's about the environment around you and how you interact with it.
Maybe we could talk a little more about the spectrum, because I actually not too long ago had a reunion with my old high school class, and two of my old friends there both have kids with ADHD and autism and something else as well. And the one is out on the very far end of the spectrum, where her child doesn't sleep, he cannot focus, he has no social knowledge in that sense, that he could just go and throw rocks at other kids if he doesn't like the looks of them, and he's quite obviously not acting as the average child in the kindergarten. But on the other ones, just have a kid that is, as you say, hyper focused and very keen to detail, and cannot eat anything because of it tastes of too much. So he only eats plain rice and plain pasta, and will never touch a tomato. But again, a lot of kids are like that. Even my kids are sometimes like that. So what's normal and what's not normal here? I mean, we are moving forward to to meeting the clients and maybe meeting a colleague in the clinic, but and sometimes people in the clinic will act very strange. But I'm trying to hone in on where the line is, or where the gray zone is from what I can expect as, let's say, normal or the majority of people, and what is strange or on the spectrum. I don't know if you get my question. I'm not sure.
Yeah, I mean, there is a massive grey zone, and I don't think that's easy for us to talk about from our side, because we're not even diagnosticians in this area. So I don't think that we should be seeing people and sort of summarizing in our head how they're presenting and saying, oh, I think they're autistic, I think I need to act this way. I think what we should be doing is being much more open and accepting and curious about people's behaviors, and not necessarily jump to conclusions about why they're behaving that way. For example, most interpretation of a stressed autistic person would be they're being rude or they're being difficult, and they don't mean to be being rude or difficult. It's the fact that they're in distress and they're not coping in that environment. So I think if we see people acting in an unexpected way, I think we should be curious about that rather than condemning them to some instant snap decision in our head about being rude, or even putting a neurodivergent label on them, because that may not be helpful for that person.
Yeah. So in a normal day in the clinic, I will meet a lot of different people, and sometimes it's just a small thing, right? I wonder, why isn't she meeting my eye contact? Is she even listening? Have I explained myself well enough? And I get the sense that I lose the conversation. And maybe lose the client in some sense. And of course, I want to be a good vet and try to communicate in that the exact way that one person needs to be communicated to, and that sort of helps my mind somewhat if I know that I should speak slower because of this, or I should avoid too precise terminology, or the opposite. I need to be very precise in my terminology.
Yes, and that's exactly it. For somebody, you may need to be one thing, and for the next client, you might need to, if it was me, I'd want to know every single detail. But if it was somebody else, of course, they might want just very basic instructions. And this is, I think, so I'm an academic, so I also have neurodivergent students. So what's really, really useful in the university setting, and which you can also take over into a veterinary setting for clients, is what's called universal design. So that's where you try and think about adjustments proactively rather than reactively. So you don't wait for the client to need something different. You present a range of options as standard, and they interact with whichever format they want. So that might be, as well as giving verbal information, you would also give some written information. So you'd have the key points written down for them to take away with them, to make sure they had understood that information. Now, that might not be necessary for every client, but you can offer it. Would you like to take that away? And there'll be some clients who may look inattentive and may not want to make eye contact, but are taking everything in. But equally, there might be people who can't focus on what you're saying at that time. So just offering people the opportunity for that, I think, can make a big difference. Equally, quiet waiting areas, I think, make a big difference for some people. And if you offer that to everybody, then you allow those that need it to take you up on it. And it's not, the great thing also about that universal design is you're not making the person have to ask for it, which in itself may be very, very difficult for them.
Yes, so, but that's general good communication advice regarding
But most of this stuff is helpful for everybody, regardless. It's not that we need to be doing, really fancy novel stuff. Most of this stuff is just general good stuff and would help everybody. You don't have to be socially anxious to sometimes want a quiet waiting area. There could be lots of reasons why people might prefer a quiet waiting area. So I think, having these sorts of things available can be really useful.
Yeah. So I sometimes here in the podcast tell a personal story, and I have one ready for today as well, because some years back, we had a breeder coming into the clinic, and it was that sort of owner. Then when we saw him on the parking lot, suddenly all the nurses would disappear from the waiting room, and the receptionist would have something very important to do, or a phone call that lasted for longer than usual, and it was only the boss at the clinic. He only wanted to see the boss, and she was the only one willing to take him in. But she needed a summer vacation at some point, and chances were that his cat turned yellow exactly that week she was on vacation, and it landed on me to see that cat. And everything, I messed up everything in that consultation. I didn't get a complete diagnosis, first of all. That was only when she came back and actually asked the right questions for the medical history. I missed a couple of blood samples because he was asking a lot of questions about liver disease, and he sort of pulled me out in that direction, that the liver disease was the most important thing, and it was actually, as I've remembered, some kind of anemia disease that the cat ending having. So he sort of derailed the whole consultation, and I didn't have the experience to keep everything on track, because he was yelling loud, he was talking too much, he was asking a lot of detailed questions that a younger vet couldn't ask. And I was actually quite frustrated and angry with him. I have to be honest. I was angry because he couldn't behave right. Mm-hmm. I sort of knew that he was concerned with his cat, but he was rude. And when the boss came back, she tried to shift my perspective a bit. So we have no idea whether he has a diagnosis or not. Probably not, but that doesn't matter actually. But she said, try to imagine him having a diagnosis like ADHD or something similar. And that's something that actually made my perspective shift a little bit, and actually feel I'm missing the right English word. It's not pity, but the other one, empathy. Yes, for him, and that actually shifted my view on the whole situation, and would probably have changed the whole interaction, because I saw him in a different light.
Yeah, and the same is true of my interaction with my kids even. I don't know yet if my son is neurodivergent or not. We're still on the fence with him. But so when I'm dealing with my daughter, if she's the sensory sensitivities about the clothing is so frustrating. She'll have 10 outfits on and off in a morning, and it'll have been okay when we bought a pair of leggings, say, but yet when it actually comes to wear them, she can't, because they'll be wrong on the waist or they'll feel wrong. And the amount of money I've wasted on clothes which then never get worn and things like that. And in the moment when you're dealing with that, it's just super frustrating. But she'll be in floods of tears because it feels wrong. And you're like, but it didn't feel wrong a week ago. What do you mean it feels wrong? But when I refocus and think, she's truly distressed about this. She's not doing this because she wants to do this. This is her communicating her distress. And that makes me have a lot more empathy about it. And, this is, even though I'm autistic as well, I don't have that sensory sensitivity. So, it is really frustrating as a mother when we need to be out of the house by 9 o'clock in the morning. It's really frustrating. But when I take that view that, behavior is communication, and when she's communicating in that not helpful way, it's still communication. And I need to remember that, and we need to find a way around it.
Mm-hmm. So on the other side, if I know that someone has a condition, I have to be very mindful of not being demeaning in my tone of voice. Of course, I usually speak fairly fast, and I can, of course, just speak slower, but I have to be very mindful not to yell louder or to use more dumbed down words, or I'm struggling to, I sometimes struggle to stay respectful and then still meet a client the right way. So if I know there's a special need here, and the requirement is somewhat off, let's say the leggings, I tend to fall on the other side of the ballpark and being less respectful in my tone of voice.
I think one thing we can do is, if you identify that things are getting derailed, you can just stop at the interaction and say, what would help? What would help you to understand, this disease? I'm sort of going back to your former difficult client. When we identify that we're getting frustrated with someone like that, if we can be mindful enough to notice that and to stop ourselves, and then refocus and say, I feel this isn't moving in a productive direction. What would help you understand where we are now and how to get to the next bit further on, sort of thing. And if you do know that there's a diagnosis, then actually asking the person what they find helpful is really, really useful, because they will, might be very used to advocating for themselves. They may not be, but, you can offer them that person, what would help you in this interaction.
So we already have two concrete things that we can try to do here. So offer a wide range of options, trying maybe to write something, or maybe to draw something on a whiteboard, trying to maybe talk in visual images, or
that's a really, really good one, actually. I didn't specifically say that, but some people, particularly ADHD, for example, they're very visual thinkers. Dyslexic people, very, very visual thinkers. So the words may not make a lot of sense, particularly, our veterinary terms don't make sense to lots of people, regardless of neurodivergence. So, but a whiteboard is really, really useful to draw things, and even do a mind map sort of thing. So yes, whiteboard's super helpful, or even just a piece of paper and a pen, can go a long way to help explain things.
I usually also, if we have a complicated workup, I draw a ladder on what's the diagnostic ladder, so we don't run all the tests at once, but we have a ladder that we work on. And the mind map, the hub and spoke mind map, where you draw a circle in the middle and you draw lines out, sort of like a starfish.
Yeah, I think I'm often guilty, because I'm quite a process driven person, but I understand the process really, really well. So I'm galloping along in my process, and forget that not everybody has the same in-depth knowledge of it. So I often have to back up, and actually the client will ask a really simple question and I'll realize that they, are still 10 steps behind, and I didn't explain something really basic because it was so obvious to me, but of course not to them. So I am often too involved and need to sort of step back and explain it in way simpler terms.
Yeah. And then the other one you said was to actually stop the conversation and put some words to what is happening in the room. So you actually stop the interaction with the animal, or with the taking the history of what, with your explaining of the disease, and then just put some words to what you see happening in the room. Is that correct?
Yeah.
So I feel like I'm losing you here in the conversation. Can you please tell me if I'm putting this right, or if I need to say something else? Is that sort of what you?
Yeah. And I notice you seem distressed, or just saying what you notice, I think, is okay, without assuming how they feel. But I notice you seem to be raising your voice.
Mm-hmm.
Are you feeling frustrated? Is there something you need explaining differently? So trying to be helpful, I guess, rather than just and I think we all do this, we just carry on, like thinking if we just keep on explaining, they're going to get it, and we may need to try a different tack. For example,
guilty of that.
Drawing. Oh, me too. But maybe we need to draw a diagram instead of just continuing to throw words at the person.
But I'd like to stay on that point for a second, because it can feel somewhat scary to point out what you feel. That's a completely different way of communicating that I think most people are used to. So we are used to communicating like we are now in the words, but actually putting words to the interaction itself is a different way of communicating.
But it's showing that you're listening. It's showing that you're actually not just talking, but that you're listening and you're attuned to the person. Yeah.
And I try to do that as much as possible, but it's not, as a vet, it's not easy to do.
Mm-hmm. Yeah, and we're sort of playing a role in that. We're the professional talking to the client, and by and large, professional people, don't sort of stop and do that. And I'm not saying we need to do it every single time, but if we notice it's sort of derailing a bit, then maybe it can be useful.
Mm-hmm. That might be a tangent, but I try to use it when I can see, sometimes when you're talking to people, you can see something shift in their eyes or in the body language, or if it's a serious conversation, people maybe have a very small tear in the corner of their eye, maybe so small that you barely don't even recognize it, but sometimes it's there, and I try to actually put words to what I see. Maybe not the other person's feelings, but I'm trying to if I see that and there's room for that, I can see that you get moved by this. Mm-hmm, mm-hmm. Please tell me what you're thinking.
Yeah.
And that sort of takes the conversation usually in a different direction, a more maybe honest and open kind of direction, and they can openly talk about, I'm afraid that you're going to say that we have to euthanize the dog now, and we can have a discussion about that instead of the nitty-gritty details of what the disease process in the liver does and so on. But we can actually have a discussion about the electricity in the room.
Yeah, and I think that's the client that's then going to really value that consultation, because you haven't just given them a load of facts, you've addressed their fears, you've recognized the fact that they are worried, and they might not have been able to express that unless you'd invited that in. So I think that's really valid.
So I know I sort of took us off on a tangent, but how does that actually relate to the neurodivergent client? Is that that's usually helpful with the clients I meet, but in the specific context of neurodivergence, is that also the way to go?
Yeah, that can also be useful. Some neurodivergent people have alexithymia, which is difficulty recognizing how they feel and recognizing emotions. So emotional awareness may not be as good as you are expecting. So they may display signs of something, but they may not actually have recognized it within themselves. So I guess just being aware of that is useful, but by and large it does still work across the board. But people may or may not take you up on it, and I think we have to, you invite the conversation, you invite them to bring an emotion in, but they may equally shut you down and not wish to talk about it. Yeah. It is very individual.
So maybe you can help us. Maybe we should look at this from the other angle, from the neurodivergent client's perspective. Maybe you can sort of help me open the box of what's going on. And so I realized that we're talking about what you just said, and then ADHD and autism and anxiety and a whole lot of other stuff. So that, but maybe you can give us a general idea of what a meeting with the vet clinic and the vet would look like, and the challenges it presents.
Yeah, so it is going to be totally individual. We can't assume everyone's going to be the same, but some specific challenges that people may experience. The environment may be overstimulating to certain people. So it might, if you've got loads and loads of glass, it might be too bright. There might be a lot of sound, there might be a lot of echo. So, for example, people may wear headphones in there or earplugs to decrease that noise. They may be wearing dark glasses if they're visually stimulated. There may be smells like the anesthetic gases or the sort of alcohol type smells. The disinfectant smells may be very stimulating to some people, and people may find that difficult. There's then social anxiety, which may be difficult being around lots of people, having to interact with lots of different people. So registering at reception and then having to sit and wait might be difficult. So, for example, if you knew that ahead of time, you could allow that person to wait in their car and you'd go out to the car park to get that client in. So that can be difficult. And then you've got different means of communicating and, so the eye contact thing that you mentioned, if that's an issue, they may find it difficult to process the information being given. They may have differing processing speeds. So they may have a lot of questions, but they don't think of them. And I'm a classic of this. I'll think of 10 questions as soon as I leave the room. So you can do things like offer, if they have questions, they can come back to you later. So that might be by phone call. If they're happy to make a phone call, you may get someone who's unhappy to make a phone call. So offering them email is useful. And this is also where sort of client information sheets can be really, really useful because they'll cover the frequently asked questions, those kind of things. Somebody may have already had a lot to deal with before they even get to the vet clinic because they may have had to, navigate traffic, which might be quite difficult for them, public transport, all those kinds of things, so there may have been multiple things even before they get to you that have decreased their tolerance for anything out of the ordinary, unexpected things is very anxiety inducing often for neurodivergent people. So having things like a visual tour of the practice available on your website can be really useful. Even things like how a basic consult will happen, what a vaccination consult looks like, the steps to that can be useful, because they want to know those details, and knowing those details ahead of time can be really, really reassuring for people. And then being misunderstood is a really, really common experience for neurodivergent people. So, people worry about being misunderstood a lot. I know that's, I often go into interactions worrying about being misunderstood. So part of your brain is constantly focused on that, so you can never give your full attention to anything else. So just being aware of things like that, I think, can be really helpful.
That was a really helpful list of a lot of things to talk about, to keep in mind if you sort of lose a conversation with the person. But you mentioned something about tolerance. So you can actually maybe you can handle a little bit of these interactions, but if there's too many of them all at once, or too many in a row, or maybe the sounds are too loud, or you would go over a threshold.
Yeah, exactly. And in its worst possible scenario, that would lead to a meltdown, which is more common in children, where, that looks like your classical tantrum, and it's often misunderstood by people as that's a child having a tantrum, but that's actually the child losing control because they are so overloaded that they can't process anything anymore, and they're just so highly distressed. Adults more usually shut down because we're much more aware of societal influence and the fact that having a meltdown is not well perceived by the general public. So what happens is all that distress, rather than being directed outwards and being seen, is actually turned inward, and the person may even become non-communicative. They may sit and rock, or bang their head, but it's all directed inwards at themselves rather than externally.
Yeah.
But is equally distressing for the person.
Yeah, I've seen both. I've seen a grown-up person have a meltdown in the waiting room, and it's not pretty. And no. I think he was in pain, not physical pain, but it sure looked like that.
Yeah,
but yeah. I do think I see the other kind more, where people sort of tune out and shut down, and I get the sense, okay, that's the end of the conversation for today. We didn't get half through it, but
yeah, there's no point going any further if that's the state they're in. They're not going to absorb anything at all.
So maybe also be respectful of that, and maybe going back to the point that you mentioned is pointing it out and asking if we should stop.
Mm-hmm. Yeah, I think so. And affording that person some privacy, just some time and space, is, in both those scenarios, is really useful. If the person's having a meltdown, they're probably going to be really not wanting you to touch them. But if you can say, would you like, to spend some time, in this room just by yourself, if you'd like to, and then we can chat again if you want, or, let me know when you're ready to chat. But equally, for a person in a meltdown, in a shutdown, affording that person some privacy just for themselves is really, really useful.
Yeah.
It's a bit like a person having a panic attack or something. You don't want to be on public display. You want a bit of privacy.
Yeah. I try to, if I have time and we have room for it, I try to excuse myself, trying to find something very important I need to pick up, and just leave the room. I'll be back in
Yeah.
5 minutes. I just need to. But it could maybe be a better strategy to actually point out that's what I'm doing. Right.
Well, I think that's equally good. I mean, the person is probably pretty much unaware of what you're doing at that point anyway.
Mm-hmm.
But yeah, I think we feel polite to say something. I'm just going to do something. But yeah, I think that's a good strategy, to be honest.
Yeah. So maybe to round out our conversation here, how would you advise people to start if they think they might be neurodivergent themselves, or to maybe to explore this a bit further, or if they want to maybe learn something about neurodivergent clients? I know you have something online as well, don't you?
Yeah, there's lots of reading available. So I think if you are interested, then look for to educate yourself a bit more about it. There is quite a lot online. There's so if you're a vet, then we recently published a study looking at autistic vets' well-being in the UK, and that's in press at the moment with the Vet Record. It's available online. It's free to view. So you can take a look at that and see how much you identify with things that people have said in that. And sort of we looked at the workplace stresses of autistic vets. So see how much you identify with the things that come out in that study, and just have a read around of how autism can present it, particularly if you're female. Then take a look at that. I've also blogged about my experience. As I said, I was missed. So I've talked about some of the things that I now recognise were related to being neurodivergent, and you can find that on the Mind Matters initiative and Me campaign. So yeah, I would recommend reading about it, seeing how much you identify with things. If you think that you maybe are neurodivergent and you feel it will be beneficial to get a diagnosis, then you can start off on the diagnostic pathway, although that can be challenging itself. For some people, they don't need a diagnosis, and they, can manage them life quite fine, or maybe they can make some adjustments, with this knowledge in mind, and equally not need a diagnosis too. I don't know the situation there, but certainly in the UK, you don't need a formal diagnosis to get reasonable adjustments, although employers like a diagnosis to give reasonable adjustments. But certainly as a client somewhere, you don't need any, nobody's going to ask you for a formal diagnosis. So, I'm a terrible patient. So if I go to the doctor, or I'm seeing a new clinician, I will make it very clear now. I know what I would like, and I'll say, I'm going to be anxious coming into this. I'll tell my dentist now, I'm going to be very anxious. I'm going to need you to be very patient with me, and I'm going to want all the details. I'm going to ask you a lot of questions. Please be patient with me.
Yeah. But that's actually a good point to end off on. I think you can contradict me if you don't agree, but this lead into being gentle to yourself and maybe to your own mind and brain, and also maybe be gentle to the client that is acting strange or needs some more time and space.
Yeah, remember that there could be a lot of trauma, with that person's upbringing. For if you take a child with ADHD, by the time, they reach adulthood, they will have been told they're lazy, to pull their socks up. I don't know if you're familiar with that expression. To pull your socks up means, do a better job.
I do get what you mean.
Yeah. Come on, you can do better, that kind of thing.
Yeah. Pull yourself
and
together.
The classic school report for a child with ADHD is would do great if only they could apply themselves in class. You know, that kind of thing.
I had that one, actually. I had that one. Yeah.
So
I'm not diagnosed with anything, but maybe I have.
But they've internalized all these messages.
Yes.
Into adulthood. So people often have poor self-esteem because they have all these absorbed messages that you're not good enough, you're not right, you don't fit in. And people don't say these things to traumatize people, of course. They think they're being helpful because if you could only apply yourself, you'd do so well. You know, but actually, when you're the person who's been told that 100 times and they're trying desperately to apply themselves, but they can't focus for whatever reason, and you know, you're told not to fiddle with anything and you've got to sit still and pay attention, which is the worst thing you can say to a person with ADHD. You know, so you don't know what's gone before, so just be mindful that the person is coming with a whole complex backstory.
Yeah, good. I will add the links to what we talked about in the show notes for today. And Kirstie, this been very educational for me and opened my mind to a lot more. I need to go back and practice in the clinic. So thank you very much for your time and all your knowledge.
You're really welcome. I've really enjoyed it too. Thank you.
Husk, at du kan finde links og noter til dagens afsnit på SIVP.dk og så episodens nummer, for eksempel SIVP.dk/1. Og føler du et behov for at udvide dine faglige færdigheder, uden at skulle tage en hel dag væk fra familien og fra klinikken, så har jeg nogle online kurser til dig. Du har måske hørt mig sige det før, men du kan få en hel måneds gratis adgang. Og det kan du få med en speciel kode, som jeg ikke deler noget andet sted end her i podcasten. Og det er fordi, at dig, der lytter til podcast, du er noget helt særligt. På SIVP.dk/XYZ får du 4 ugers gratis adgang til kurserne og protokollerne på hjemmesiden. Alle kurserne har specifikke læringsmål, så du ved præcist, hvad du får ud af den tid, du investerer i det. Du kan for eksempel lære at lave en regelret neurologisk undersøgelse og bruge det allerede næste gang, du er på klinikken. Du kan også lære at tolke blodprøver, og du kan lære at lave et godt finlåsaspirat og tolke det sikkert. Der er meget mere, men kig over på SIVP.dk/XYZ og tilmeld dig den gratis adgang, så kan du se, hvad du kan lære og bruge allerede næste gang, du er på klinikken. Udover alt det, så får du også adgang til et lukket online forum, hvor du trygt og sikkert kan dele alle dine i gåseøjne dumme spørgsmål. Dem er der selvfølgelig ikke nogen af. Men vi er sammen om at lære. Du skal ikke lære alene. Vi er sammen om at blive bedre. Og så ved jeg godt, at der er nogen, der er bekymret for at tilmelde sig et medlemskab. De er måske bange for ikke at få det brugt. Og jeg ved godt, at du som lytter til det her, jo går op i din faglige udvikling, for ellers havde du jo ikke lyttet til podcast. Men skulle du nu alligevel være bekymret for at glemme at melde dig fra, når din gratis måned udløber, så skriv lige til mig. Jeg har nemlig resultatgaranti, og det betyder, at hvis ikke du ser resultater i din hverdag, så skal du selvfølgelig ikke betale for noget for at have været på kursus hos mig. Se på SIVP.dk/XYZ for at tilmelde dig en gratis måned med det samme. Vi ses!